We are now live, Michelle. We are live. No swearing.
Exciting. Okay. Be very good.
Hello, everybody that's on the call so far. Just a little bit of housekeeping before we start and give people a chance to come in. If you want to put in the public chat, you'll see a chat bar on the right-hand side. Any questions as you go through will come through to them at the end, or if you want to put your name and where you come from or anything like that, or a little joke, anything you fancy, put it into the public chat, and we will have a look at it there. We'll just give another couple of minutes, a minute or so, to let people jump on the call. Let me now fiddle around with the thumbnails. Right, I know where I'm going to go next. Right, let me type in the public chat. Hello, this is the chat. So everyone will see that pop up, hopefully on their screen, and they'll see what's happening there. And I'll keep an eye on that. Right. First things first, hello everybody, and thanks for joining us for today's Care Club Online. My name is Hannah, and this is Michelle, and we're just going to go over the overview first of what today will be, and then we'll do introductions and all that jazz. So we're going to have a word on Caregivers Connect, which is a really good resource that helps caregivers moving forward that Ontex have pulled together. So that's a resource that we think you'll find really useful. And then there's a lot of support in terms of incontinence care, and that's what Michelle will be talking about. And then, as I mentioned, we've got question time, and the ability to share any top tips that you've got will be really welcomed. So introductions. For those who haven't met me before, my name's Hannah Montgomery, and I'm one of the co-founders of Grace Cares. And Michelle, give us a wave.
Hello.
We got Michelle, and she's part of Caregivers Connect as well as Ontex, who are our supporters for Care Club as a whole. So she'll be talking all things incontinence, because they've got top technologies that are better than other, we shall not name, other products that have actually been tested, have they not? That they have. Yeah.
Yes.
The science backs it up. It's not just me saying, yeah, we have the science. So before I let Michelle tell you all the good stuff, I thought for those that don't know about Grace Cares, I'll give a quick overview of how we can help. So Grace Cares is a not-for-profit. We're based in Lichfield, but we work across the UK. We get NHS trusts and councils give us their used care equipment. We clean it, maintain it, infection control, do all the good stuff, PAT testing, Lola testing, whatever it needs. And then we sell that equipment on. So if you are looking for some certain care equipment that you can get hold of, you can purchase that from us at half the RRP or less. If you have financial hardship, or just haven't got the pennies for the equipment, that's not a problem either. We have hardship grants open to unpaid caregivers across the UK, so you can apply for some support there, and we'll try our very best to help you out. We also have monthly tea parties and sustainable activities. These are predominantly for over 70s, so if you know anybody local in Staffordshire, please send them our details and they can join in those. And we also have Care Club. So that's what this is. This is online Care Club, but we have face-to-face Care Club where we get in a room, and it's based in Lichfield, and we have a different speaker each month that offers support tailored to unpaid caregivers' needs. So our last face-to-face one was incontinence care, hence why we're doing this one online to share the learnings from that session. But if you get in contact with me at any point, we can send you more details. So I shall move over to the lovely Michelle to tell you about Caregivers Connect and how that can help.
Hello, yes, I'm Michelle. I work for Ontex. I am the marketing manager for Ontex, but all of the information that I've got here today is all given to me by our nurses. We've got a large team of nurses, so it's all correct. It's just if you've got any questions that potentially only a nurse can do, then I'll pass it on. I can get back to you. So I'll just quickly go about Caregivers Connect. So we've got a brand new platform. Oh no, I've failed at the skipping.
You haven't.
I know. We've got a brand new platform and it's called Caregivers Connect. And basically it's a place where all unpaid carers can go to get information on the best ways to care for a loved one or a family member, or maybe how to deal with their medicine, or how to maybe get them the best exercise. So that's one side of it. But then the other side of it, you've got how to look after yourself, because a lot of the time you're putting all of the effort in to looking after someone else, but then you forget to look after yourself. So there's blogs, there's hints, there's tips, there's meditation on there, there's podcasts, and we've got a new community where you can actually chat to other people like you. So if you've got an issue, there's probably someone else on there that's probably had the same issue, and then you can chat and kind of get ideas together. We've got a huge community, and we're working alongside people on TikTok and Instagram. So we've got loads of influencers to help give you the latest information as well. So there's videos up there as well as webinars and everything. So you'll get sent the slides afterwards, but these are the QR codes if you wanted to have a look at that. Everyone who does sign up to Caregivers Connect gets the Caregivers pack anyway, with all like the best tools to kind of help you on a daily basis. So yeah, we'll send that across to you. And then I will go into my continence care talk then.
Cool.
So I won't bore you too much about Ontex, but we are a very large manufacturer of continence products, basically, and we've been doing it for over 40 years. We do adult care, so that's your continence products. Then we do feminine care, so all your feminine hygiene products, and we also do baby care, so that's all of your nappies. So we do it in 10 different countries as well. So we like to think that we know what we're talking about. We've got millions of customers. So yes, and like I said, all of this information has come from our nurse advisors. So the main thing is just like, what is incontinence? And it is just the involuntary loss of urine or feces, and there's so many different types of it. It could be that you've got an inability to get to the toilet in time, or maybe it's too far away, or you haven't got access to one. Or you could have had, I don't know, some medication that might not be quite right, and that could have messed with it. So there's lots of different types of it. I think the main thing to remember is that incontinence is, I think it says it on this one. Incontinence is not a disease. It's always like a byproduct of something else. So it's not, you don't need to go to your GP and say, I've got incontinence and that is my only issue. Normally it is due to surgery, or if you've just given birth, or like I say, medication. It can react with each other and make you incontinent. So there's normally always an underlying issue. So our advice is, before you go straight to incontinence pads or anything, make sure that you talk to your GP. You can see on the screen, it's any of these things. So if you want to make sure that you don't become incontinent, you've got to make sure that, one, you know when you need to go to the toilet, where you need to go to the toilet, and make sure that you can hold it until you get there. And when you're doing that at work, it might be that you can request a table or a desk that's closer to the toilets, so you can make sure that you've got a path. And scheduling regular breaks as well makes your body have a much better routine. So you get used to kind of holding it in, and it stops the need to just go constantly. With incontinence, it actually affects more people than you think it does. I know I was surprised when I first started, and it's not always the older generation either. I think 1 in 5 of us will deal with incontinence at some stage in your life, and because it's still quite taboo, it can create a lot of anxiety, social isolation, low self-confidence. It can really make you feel like you've got nobody to speak to. But there are so many different forums where you can get help, speak to someone, and there's places like Bladder and Bowel and stuff that you're not alone. There are literally thousands of people, especially in the UK, that have to deal with it on a daily basis, and it really is not always permanent. It can be reversed. So what can you do about it? I'll go a bit more into lifestyle and diet on the next page, but actually a lot of changes within your diet, your eating and drinking, can change whether you are incontinent or not, and it makes a massive difference. Bladder training exercises. So you think that it's only women that have to do pelvic floors, but actually men need to do it as well. So you can go onto, I don't know, Google or YouTube, and it teaches you how to do the exercises, and just doing them a few times a day can really, really help. It can reduce it a lot. Incontinence can, medical treatment, sometimes it might be you might need a tablet that stops it, or it might be, like I said earlier, it might be medication that's maybe they're not quite working well together. So just changing your medication can help with incontinence. In more serious situations, surgery is one of the reasons that it happens, or you might need surgery to fix it. But obviously, as we always say, always seek medical advice first. Don't just go, oh, well, I'm incontinent, that's my life now, I better use pads, because there is more than likely something that you can do about it. Move on to the next one. So this is just a quick bit about drinking. So I think a lot of people think, oh, if I'm incontinent, I'll drink less, and then I won't need to go as much. Yeah. But that actually makes it worse. So when you don't drink, everything is a lot stronger and it's a lot more acidic. And when you haven't got much liquid flowing through your bladder, it actually irritates it. So and that's when you lose a bit of your control over it, and that's when you actually can make the incontinence a bit worse. So the best things to do is to drink as much water and squash as you possibly can, and try to get rid of things like fizzy drinks are not great. Anything acidic, because that goes through and it irritates the bladder. Anything with caffeine, because again, that kind of goes straight through, and drinks with artificial sweeteners as well. We're not saying don't have them at all. Just, if you're going to have 20 cups of coffee a day, maybe take it down to 2, and it will really, really help. With food, it's all about irritating, because obviously it all gets absorbed, and then it passes around your body, and stuff that's kind of highly spiced or highly acidic, especially citrus foods, tomatoes, vinegar, any that kind of thing, salt, as it's going through, it can really irritate. So you kind of lose that control. So again, not saying you don't have them, but if you just have less of them, and try and eat more proteins and fiber rich food, and get your vegetables packed in. So if you've spoken to your GP and for the time being they're telling you, right, you need some kind of continence products, I thought I'd just do a quick run through of the types of continence products that you can use and why you would need them. So this is just a brief overview. So your first one, they're rectangular inserts. They're sticky. So you might know this with kind of like feminine products where you peel off the back. These are for light incontinence, and they're just kind of cheap and cheerful. You can get loads of them, but they don't have that nice shape that kind of contours to your body to kind of catch everything, but they're just for light incontinence. Mm-hmm. Then you've got small ones. So this is for really light incontinence, and it's for things like, if you laugh and maybe a little bit comes out, or maybe if you cough and maybe you lose a bit, it tends to happen possibly after surgery and having a baby. So, and because they're so small and discreet, no one will know that you're wearing them. So they've got odor control, and we even test them. So like they don't make that swishing plasticky noise when you walk, because that's embarrassing. So we make sure that they don't make any noise either.
Cool.
There's also male specific pads. You can see from the shape, they're just specifically designed for the male anatomy. And they're normally for like lighter incontinence as well. You've got your large shaped pads. So these are the ones I can show you. I have one.
Oh, wow.
So they normally come like this, folded. Yep. They spread out. You can kind of see the shape. And they just fit into your underwear. They're very, very discreet. And I'll give you a little tip on how the best way to use these. So they come, I don't know whether you can see, they come folded like this. The best thing to do is to open them up fully.
Hang on, Michelle. Can I make you a bigger screen? I'm making a big screen.
Yes. So open them fully and then fold them lengthways. And then once you've folded them lengthways, kind of push them up the way up, and that makes it so it's the exact shape that you need it, so it fits into your underwear properly, but it also activates the anti-leak cups, which are here.
Okay,
And
that makes sense.
so without that, you might get a leakage, but that is I don't think many people know it, because you're supposed to do it with baby nappies as well, but I don't think it's common knowledge. So that's shaped pads.
Top tip already. Thanks.
Excellent. All-in-ones. These are more like nappies, so you would use these normally if you are looking after somebody. They're not as easy to do yourself. So if you're looking after somebody, and normally you need 2 people to do this, because especially if they're kind of bed bound, because you need someone to kind of like lift the person up, get them under, and then put the tabs on either side. And these ones have got wetness indicators on, so it's 2 lines running down, and once those lines turn blue 3/4 of the way up, then you can look at the person that you're carrying and know whether they need changing or not.
Okay.
Net pants. These are like they said, they're net pants, and you put the shaped pads inside them if you don't want to use your own underwear. And these can be washed up to 50 times, so you can just keep going with them if you don't want to use your own. Then we've got belted ones. Again, these are more if you're looking after somebody and if there's 1 or 2 of you, and it just means if they do have kind of weight fluctuations, or if you're looking after a few different people, the belt makes it like very easy to adjust. So it kind of like, especially if they're moving and everything, you can kind of pull it tight, and then it's a much better fit. And the last one is adult pants. These very easy if you're doing it yourself. They act like regular underwear. You can just pull them up nice and easy, and they do get used a lot with dementia patients, because as they kind of come in and out, don't they, back to you, and sometimes they can look down and see the pad, and it kind of shocks them, and they're like, what is this? So when you're just using pants, it's so much easier. This is just a little bit about the wetness lines that I was talking about. So most pads that you'll see have got these 2 lines down the edge, and they will turn blue as they get full, basically. And once they're 3/4 of the way full, that's when you know that they've got to be changed. Obviously, this isn't the case if it's kind of fecal incontinence. You've kind of got to use your own assessment for that one, but you can, it's normally easy to tell. If you are buying incontinence products, it doesn't matter what products you buy for, ours, Tena, anyone else, they'll all have these droplets on them. Obviously, the more droplets that are full, the more that it will take, the more liquid that it will take. Don't necessarily buy, you go, oh, I'm incontinent, I've got to buy a super or a maxi. It's better to buy for the amount of continence that you've got. So if you're only losing a little bit, we'd say go to the discreet ones or go to normal, because what you don't want, there's no point in having a super and then using it like a tiny bit of it's a bit of a waste. But also they're not something that you can just use over and over again for the entire day, because it'll start irritating your skin, and it'll so just kind of have a good think about, the person you're looking after, how much they're actually losing, and then buy the correct droplets like accordingly. I won't go into too much detail, but I'll just quickly tell you about the skin.
Okay.
We do a lot of research about the skin. So our brand new products have come out, and they have got a sensitive top layer. So it's zinc, it's hypoallergenic, so it won't cause any irritation. And we make sure that even with 2 or 3 voids of liquid into our pads, you won't get any soak back. So what that means is, if I put a load of liquid into a pad and then I squished it down, you're not going to get any liquid come back out. The material traps it, and it's that liquid that comes back out and sits on your skin that causes rashes, irritation, discomfort. It can be really, really sore. So that's why it's really, really important to check the wetness indicators and change them regularly. We also recommend, if you're going to use a barrier cream, so people do it with babies a lot, they use Sudocrem, but any kind of cream like that, that's absolutely fine. But because it's oil based, it doesn't wash off with water, so it does create a very nice barrier. But when that gets onto the top layer of the pads, it means that it's created a barrier against the water that you're preparing to put in it as well. Yeah.
Oh, wow. Okay.
So it kind of means that it's not going to do its job, and then it will spread, and then you will get skin irritation. So if you are going to use creams, either get it prescribed by your GP or find one that's water based, and then you don't need much anyway, but you know, you're not going to have skin issues. One thing we'd say as well, don't double pad. Sometimes we hear this where people go, oh, well, I need extra protection, I'm going to put 2 pads on top of each other. But the back of all the pads have, it doesn't look it, but they're completely waterproof, obviously, so that once it's trapped the liquid, it's not going
not going
into your
anywhere.
trousers. So if you put 2 on top of each other, it will never come out of the top pad into the other one. So all it will do is sit there and just cause you to have skin irritation. So we suggest not doing it.
Yeah, no, that makes sense. And think of
Yes.
the money you save. You're not paying double the price for the same.
Exactly. We have actually heard as well. So there's like underpads that you can use as well, and they're just there just in case, especially if you're changing someone and it just kind of does a bit of a catchment, just,
Yeah.
you know, if anything does come out or anything. And we have heard that people have been using dog pads because they're slightly cheaper. But the problem is with dog pads is the chemicals that are in there to trap dog urine are not the same as people urine. So you can lie on them, or you can put, perhaps like a human can like urinate on it, but it actually reacts really badly with some of the chemicals in there because they're not for us. And we've heard of times where it's actually burnt people's skin. So we would advise very much against that. Always go for a pad, a normal people bed pad, not dog one, not puppy pads.
No puppy pads. Cool. Top tips.
Yeah. So troubleshooting. So once you've spoken to your GP and they have given you a pad, you might have a bit of troubleshooting to start with. It might be that you've got leakage and you think, well, this is no good, it's not working. But a lot of the times it's that it's not the right fitting. So what we need when you're measuring to get a pad for yourself or someone else, you get the tape measure and you do it round the belly button. And those are the waist measurements that you need to be looking onto the packet. So you don't just go, oh, well, I feel like I'm a slightly bigger person, I'm going to buy XL. Not necessarily. It might be that you've got a smaller waist and you might be in a medium. And if you're in an XL, obviously it's got room to move around, and that's where you're going to get leakage.
Right.
So you've always got to make sure you've got the correct size. Obviously, use my little tip to do it lengthwise.
Let me pull you back onto the big screen.
Oh,
just
yes, I'll show you again.
So I think that's a really top tip. I'd never know that. And you can see that the guard is propped up then.
Yeah, it's much, much better. And you might get leakage because if you haven't done this, then your anti-leak cuffs aren't up and they're not anti-leaking. They're just letting everything go around. It might also be that you're possibly, or you or your family member or anything that you're looking after might be more incontinent than you think. So you might have bought, I don't know, a normal pad, but you're getting leaks because they're producing a lot more than you thought, basically. So it's always best to go back to the GP and ask for another assessment if that's the case. Because what they'll do is they'll do it's called a bladder and bowel diary. So they do 3 days worth of like, what are you eating? What are you drinking? How many times do you go to the toilet? You know, how many times are you changing a pad? That kind of thing. And then once they've done that assessment, then they might change the product that you're in to stop any leakage. And then it also might be that, you've used some barrier cream, such as Sudocrem, and you've got it on the top and it stopped it from absorbing, and then it's kind of leaked afterwards. So always best to check. When you're storing them, probably the best place you think is, well, I need them in the bathroom, so I'm going to store them in the bathroom. And that is only good if they're kind of in like an airtight container. Obviously the pads are meant to absorb liquid very, very quickly and very, very well. So if you've just got them loose in your bathroom and you have a shower or you have a bath and you've got all that moisture in the air, then your pads will be soaking that up. And then when you go to use them, like, it could be a lot of the material inside the pad has already soaked up some liquid. So you go to use it as normal and it doesn't have the capacity anymore. So that's where you get leaks. So definitely store them in a cool, dry place. Depending if you're in care home, or if you can store it in their bedroom or your bedroom, that's the best way to do it. And then obviously don't flush the products down the toilet because they are quite large and they will cause issues.
Yeah.
Oh, sorry, that was me.
No worries.
So who do you contact? Because a lot of the time it's just like, oh, I've gone to speak to my GP and they haven't got time for me, or it's really hard to get in contact with my GP. Obviously, we would say GP first, because they might not have a solution straight away, but they've got access to lots and lots of different services that they can put you in contact with.
Yeah.
But if you can't get through to your GP, there are very useful helplines, basically. So one of such helplines, a bladder and bowel. They've got it's a completely free helpline. You can go onto their website. There's full of top tips, but they also have nurse advisors as well that will tell you, okay, right, this is kind of what we advise, or this is how you get onto the process, or this is who you can speak to. So it's worth kind of trying everyone. Obviously, once you've got your GP, they'll put you in contact with the bladder and bowel service, and that's when they'll get your assessments. And then depending on what area you live in, you probably will get your pads on prescription.
Okay.
It does depend on the area, though, depending on what you can get. But yeah, you can get it through the NHS. And then where to get products. So you can go to your local supermarket. Now that you know all about the droplet scale and absorbencies, you can find various different types of pads at the supermarket that you can buy, especially places like Boots and everything. GP Continence team, where you can potentially get them on prescription. And then shameless plug, you can get them on ID Direct, and those are all of our Ontex products that you can just get ordered. And then I've just reiterated the puppy pad thing again when you get the slides. But that is a whistle-stop tour of incontinence products and who you can speak to. And if you've got any questions, please let me know. I'm happy to help. I'll pass it over to you, Hannah.
I do have some questions, because I was looking at all the different pad varieties. Like, how much do pads cost on average, and what's the most popular pad that you sell?
So we supply mostly to NHS. So
Okay.
the shaped pads are the ones that people tend to use the most, because you can use your normal underwear, and then it's just a case of popping it in, and there's one for every single size, and they're unisex, and their absorbencies are pretty big. And again, there's odor control and everything. So those are probably the main ones. And then probably pants, because they're just easy, aren't they? It's just, they look and feel like your normal underwear. They're kind of made from cotton. They're elasticated. So yeah, I think those are our main ones.
And when you talked about not having coffee or reducing that, is that because of the caffeine in it, or is it just something to do? If I had decaffeinated coffee or decaffeinated tea, would that be a preferable choice over caffeinated?
Yeah. So it's the caffeine. It's a bit of an irritant. I mean, in reality, we should probably all be drinking only 1 to 2 cups of coffee a day anyway, for the amount of caffeine. I can't remember what your daily allowance is, but I drink energy drinks, so I have to limit myself to 1 a day. No, 1 a day. But yeah, it just irritates you. So if you are somebody that likes drinking coffee and tea throughout the day, if you can just have 1 or 2 that are caffeinated and then switch to decaffeinated for the rest of the day, it will really, really help.
Yeah. And have you heard, so I've been having a discussion with a family member about continence care. And have you heard of the chairs that you can sit in that are meant to help tighten, and pull and help you? Is there any medical facts on that, or are we just being sold snake oil kind of a thing?
I mean, they probably will help, because they'll probably make your muscles tighten the way that you should. But realistically, it's just most of us, you can do it right now. If you think about it, you can tighten the muscles kind of like around your bum and your legs. And you can go onto Google and YouTube and try and know how to do your pelvic floor muscles, but you can just do it when you're walking or sitting down. So if you just say to yourself, right, 3 times a day, I'm going to sit there and do some pelvic floors. You can do it for free.
Yeah, well, there's a person that I saw when I was trying to help this person that does it almost to song, so it's actually enjoyable. So you're going, or whatever, and this person on the internet's telling you when to be in, breathing, and I'm like, wow, it's just fascinating. Everyone should be doing this anyway. Why aren't we being taught about this? And
I think they only really emphasize it once you've had a baby, once a woman has had a baby. But it's for everyone. I mean, I only recently learned last year that men are supposed to do it. So and I work in the continence sector.
You're in the gang.
So it is really not common knowledge, but they're very, very easy exercises, and if it can help you, it's definitely worth it.
Yeah, no, I'm just going to go along here and have a read. So Sarah, hello Sarah, nice to see you. She's the deputy manager for Cerebral Palsy Midlands, and they look after people with significant and complex needs, having cerebral palsy, and totally dependent on physical care, and some have involuntary movements themselves. And a lot of their citizens sometimes struggle when they're out in the community, as they have a lack of changing place toilets for pad changing. So that can limit how long they can stay out. Can you imagine if you don't know where you can't go to a new place because you need to scope out where those changing, you're not guaranteed to have those changing places, and that's where you think about things like double padding as a one of a kind circumstance for dignity.
And it does happen. Yeah, it happens a lot, and it's especially bad with men, because obviously mostly in women's toilets there's normally a bin, and you've probably got the baby change, so you can kind of use those areas. But for men, they don't normally have access to that. So there are campaigns to try and get more bins in for men. But if that is the case, then double padding just definitely, well, like I say, it won't work. So if that really is the case, worst case scenario, you just go for a more absorbent pad so that you can go for longer and then get it changed as soon as you get home. But obviously when you're double padding, it can't go anywhere. So you're essentially just sticking one to the back of a used pad, and it's not really doing anything.
Yeah, okay. But you can understand, you'd just be desperately trying to try
100%. Yeah. We get it. We've seen new nurses, but doing it because it's just like, well, that's what they've always done on the ward, and this is why it's really important to do our nurses training, because not everybody, nurses are expected to know absolutely everything, and it's impossible. So that's why we're always in there to keep reiterating the training. These are the pads you should be using.
So I'm going to throw a curveball in here, Michelle, and I'm going to hope you're going to say yes. So Sarah's just put, we've tried most insolvent pads and unfortunately still had our citizens have accidents. Would you be able to maybe offer a one-time discount code to Sarah to try some of your products to see if your pads would hit the bill in terms of the accidents and to support the people that they're supporting?
Yes, we do have discount codes running. Apologies, I haven't looked up the exact one that's running at the moment.
I've completely thrown you under there. And this is an omnipresent care club. There isn't always these. Only people that are live on the call can get the discount code. So if you're watching this on repeat, I'm sorry, you snooze, you lose. Well, maybe reach out to us and I'll put our contact details on again.
It's either 10 or 15%, but we do offer just for people on this call, we can send you some free samples if you wanted to try, because a lot of the time it is to do with the assessments, and if people are not wearing the correct ones, then they will get leakages. So yeah, I've just seen one of the questions. It's not so we do, our nurse advisors do the assessments, but it's mostly the training, so we do it kind of through the NHS. What you'll need to do is, for your area, you'll need to speak to your GP and they'll talk to the continence team, and then you'll have somebody either come out to you or you'll visit them, and that's where they'll do the 3-day diary. They'll take all your measurements, and normally a lot of the time, even with the measurements, it can be trial and error with what product suits you, or what you're happy with. So yeah, once they've done that assessment, then they'll probably try you with a few different samples, and then work out which one works best. But like I say, we can offer some different samples to help if you want to try them.
Oh, that's very, very kind. So conscious of everybody's time, and can see that there's questions. And after you've watched this, even if you've watched it in hindsight and on a repeat, you'll see the contact details there for myself. If you've got any questions that I can help with, I'll try my best. But Michelle, in terms of the incontinence advice, should be able to help further. And in terms of that very, very kind offer of samples and discounts, message Michelle. Her things are on
message
the
me.
message Michelle. But just thank you, Michelle, for all of that knowledge. Water-based barrier creams, I wouldn't have thought of. Measuring from the belly button, all of these top tips that you just think of that are just going to be game changers, and it's really important.
No, well, thank you for having me. It has been a pleasure.
Cool. Right, I'm going to end the live. Thanks, everybody. Speak to you soon.
Thanks, everyone. Bye.